I want to thank every one of you, of our board members, for being here today and coming to hear my proposal that I will be making on educating patients and their families on type 1 diabetes. I want to give you a handout that I will be referring to today in my proposal. Type 1 diabetes is a very tough situation to be in when you first are diagnosed. Uh, Personally, on a personal level, my son was diagnosed with diabetes when he was 3 years old, and it was a tough situation for my wife and I. We didn't know what to expect. We didn't know what we were going to do, but thankfully, for patient educators and handouts like these, uh, we were able to understand more and more about diabetes type 1. Today I want to propose giving our diabetes type 1 patients a handout that will introduce them to dealing with type 1 diabetes. This handout will also be available in Spanish, and also we're looking to translate it in the Navajo language because we have a lot of Spanish speaking and also Native American Navajo speaking patients that we are seeing come in more and more into our facility. We want to be in accordance with our class standard in making sure we're communicating with the cultures and the languages we are dealing with. The handout that I present to you today will have three topics. The title of it is Taking Care of Your Type 1 Diabetes. The three topics that we will be covering is uh, what is type 1 diabetes will be the first topic. Inside that, you'll find a comparison of type 1 diabetes and type 2 diabetes. Second topic will be checking your blood sugar. We're giving um, an 8 steps to checking your blood sugar for the first time. For these first timers that do not know how to check their sugar, there will be an 8-step process for them to learn how to do that. Last, we want to relieve the patient of stress of thinking that they're not able to live a normal life now that they have diabetes type 1. We want them to know that there's nothing stopping them from exercising, from eating all the different foods they like to eat, from doing any type of functions, physical functions that they like to do. As long as they take care of their diabetes by checking their sugars and giving themselves the right amount of insulin. Uh, Also, in this last topic, we'll cover nutrition. Nutrition is a very important part of diabetes type 1, so we want to cover that part. Also, available in this pamphlet, we let them know that there is a nutritionist on our team that can help them understand uh, more on how to diet while having this type 1 diabetes. I will be having two of our supervisors, helping me take care of this handout. We still have some work to do on it, some perfectioning to do on it, revising, and I'm going to have one of our leaders, which is Miss Kim Anderson, will be helping me do that part and also doing the printing. Uh, the other person that I will be using is Mr. George Hernandez, another one of our supervisors. Will be taking care of making sure that this handout is in Spanish and in the Navajo language, which are the predominant languages other than English that we are seeing here in our facility today. When these handouts are ready, it will be the responsibility of all our employees to make sure that these handouts are given to the patients and that we are well stocked and ready to be handed out. Once again, I want to reiterate the importance of educating diabetes type 1 patients to relieve the fear and stress that they will feel when they are diagnosed with this disease. It can be a frightening situation, and we want to help them in that hard time that they are having. This is a handout to inform our patients of what to expect now that they have diabetes type 1. To all our board members, I want to thank you for hearing my proposal. I hope that you like the handout and that you will consider in approving this project that we have for our facility today. Thank you very much.